Welcome to a new episode of Historically Speaking. I am your host and presenter, Michael Dwyer. 17 years ago, Tom Carpenter hosted me for an episode of Historically Speaking, which was part of a series called The Health of the City. We did a show on the influenza epidemic of 1918-1919, particularly how it impacted people in the city of Rutland and the immediate area. Why then would we be doing a recut of the same show that we did 17 years ago? There's a twofold answer to that. First, because we are in the midst of a COVID epidemic. Who would have thought that we would be thinking about things like quarantine, banning of social gatherings, wearing masks, social distancing, sanitary precautions, and the like. And because of that perspective, we look back in time to see how people coped with one of the greatest health crises that's ever impacted the United States. That's one reason. The other reason is that we now have access to the Rutland Herald through a digital index. The index is available through the Rutland Herald itself and through the state of Vermont. So whereas before we would have to go to the Rutland Library and troll through microfilm images and have limited availability for making images, now this wonderful resource is literally available at home at our fingertips. We are going to go back now and look at the flu epidemic of 1918 with images and with clippings from the Rutland Herald. October 2020, more than 6 months into the COVID pandemic, over 210,000 American deaths, 32,000 of which were in New York City. As I spoke to some of my friends who live in the big city throughout this crisis, I could hear ambulances roaring in the background. How does this compare to what Americans were dealing with a century ago? This image, which comes to us from the National Archives, shows Red Cross volunteers in the city of St. Louis taking bodies away to be buried. We notice right away that they are wearing masks. October 1918 remains the single deadliest month in American history. 195,000 people died that month. The largest numbers hit in cities such as Philadelphia, where the death toll was 700 times the normal rate. It's worthwhile, before we look specifically at how this impacted our area, to consider some of the rather appalling statistics about the flu pandemic of 1918. It was an airborne virus, an avian virus known as H1N1. At that time, we did not have the medical technology for steroids to suppress the immune system to combat the disease. There were no antibiotics to prevent the spreading of secondary bacterial infections. And the other thing so familiar to us today throughout this pandemic is that there were no respirators or ventilators. 675,000 people died in the United States, and estimates of the number of worldwide deaths vary between 30 and 50 million. The complicating factor for us as we look at the story of the influenza epidemic is that it played out against the larger story of the final days of America's involvement in World War I. Ironically, 10 times the number of people died of influenza than actually died in battle deaths. As we recall the horror and the virulence of the disease, we need to think of how it first came into the public view in Rutland. Here is a headline from page 8 of the Rutland Herald, September 28, 1918, where it describes 6,824 new cases of influenza in the camps. What we have to remember here is that this virus, which likely originated perhaps in the United States, went with troops to Europe, was greatly exacerbated by the return of troops home, troops that were transported in tight quarters on troop ships, and then as people began to get sick in military hospitals where they were stacked up in bunk beds in close proximity to one another, this was how an airborne virus struck so many people. In an American Experience episode that aired in 2003, we have a letter that was quoted from a doctor who was a United States soldier to one of his friends, also a fellow physician. And these are how he described the symptoms. These men start with what appears to be an attack of la grippe or influenza, and when they are brought to the hospital, they very rapidly develop the most viscous type of pneumonia that has ever been seen. 2 hours after admission, they have the mahogany spots over the cheeks, and a few hours later, you can begin to see cyanosis extending from their ears and spreading all over the face until it is hard to distinguish whether these men were black or white. It is only a matter of a few hours until death comes, and it is simply a struggle for air until they suffocate. It is horrible. By October 2nd, there are more headlines in the Rutland Herald. Again, we find these towards the back of the newspaper. We begin to see that by October 2nd, 1918, there are 19 new cases of Spanish influenza, as it was called then, that were reported to Dr. George Rusted, the city health officer. And by now, the disease reached a total of 69 since it first made its appearance in Rutland. Further in the same article, it reads that people will observe every possible precaution is the hope of the health officials in order that the epidemic may not attain the proportions it has in Montpelier and other places in the state where conditions are tragic. As I was looking through death certificates 17 years ago in the City Hall vault, I came across that of Private Joseph Raymond. And this is very, very typical of how the disease spread, because Private Raymond actually died at Camp Devens on October 2nd, 1918. His body was brought home. And here on October 5th, 1918, we have Private Joseph Raymond's obituary, and we have the mention that the body was brought home to Rutland yesterday morning and was taken to the soldiers' late home. And perhaps what people did not realize in 1918, with a virus that was too small to be seen by a microscope, is that a body still could bear the signs of contamination from the virus. October 4th, 1918. Influenza continues to spread, deaths increasing in camps. Since the scourge made its appearance there, it has been reported in the United States Army camps 113,737 cases. Once again, this is not something that is making the front page of the Rutland Herald. It was still filled with headlines about war news. The more that things stay the same, the more that things are different, the more that they stay the same, so the saying goes. City not obeying Board of Health regulations. Gatherings are held despite orders to prevent the spread of influenza. Reading a bit to you from this particular caption, the influenza situation in Rutland was slightly more encouraging yesterday afternoon, only 12 houses having been reported for quarantine. And the article goes on to say that in many instances throughout the city, there were some people who simply were very, very reluctant to obey the orders of quarantine if people in their home were ill. Continuing, October 7th, 1918, more than 10,000 cases in Vermont, says the State Board of Health. Looking through a bit of this clipping here, deaths are from pneumonia, the most common complication following influenza, and it's starting to hit the city in a way that people are beginning to pay attention. In the midst of all of this, among serious reporting, we also have ads. And one wonders how some of these things could have been promulgated, considering that back in 1906 we have the Pure Food and Drug Act. So here, for the Spanish influenza, while you have mysterious pain ease in your home, they have this compound which is for pain ease for pneumonia. And I like this one for pneumonia. Apply mysterious pain ease freely on the chest and between the shoulders. Its wonderful penetration stimulates the circulation, reduces the inflammation, and prevents the formation of unnatural secretions in the lungs. Doctors prescribe it. Why don't you? I don't think there was ever any clinical study done on whether or not any of this worked. And again, here people are making their own testimonials as to what they are doing for influenza. And here, a Rutland woman who has had experience in previous epidemics in treating her own family submits the following treatment as an excellent way when it is impossible to get a physician quickly. She writes, a mustard paste composed of the white of 1 egg stirred thick with mustard and applied to the pit of the stomach and back of the neck alternately for 20 minutes at a time, 2 or 3, 4 times, depending on the severity of the attack and response to the treatment. Now, as the epidemic becomes much more serious, we have the question of morale here. The quelling influenza and a question of morale. If Rutland people help and keep well, the scourge will be abated. Dr. Rusfeld, who was in the news virtually every day in October of 1918, reported that there were 27 houses placarded containing 40 cases for influenza, a few more than Monday, but not as many as Sunday, the worst day since the epidemic began, when 51 cases were reported. That Rutland has not suffered in comparison with several cities in the state is shown by the fact that upwards of 600 cases, only 11 deaths had resulted up to a late hour last night. Mayor Henry Brislin has anticipated an emergency demand for hospital accommodations and is fully prepared to meet more serious conditions should they develop. Now, as in all health crises, what we have to realize is the limited capacity and the limited number of beds within a hospital to meet a health crisis. And we know certainly that although Rutland Hospital stepped up valiantly to meet that challenge, it still was a tremendous drain on resources and a shortage of personnel. This appeared in the Rutland Herald for safety precautions. And not reading all of it, but many of these things will find a certain amount of familiarity today. Protect others by sneezing and coughing into handkerchiefs or cloths, which should be boiled or burned. Insist that whoever gives you water or food enters the sick room for any purpose shall wear a gauze mask, which will be obtained from the Red Cross or be made at home of 4 to 6 folds of gauze, and which should cover the nose and mouth and be tied behind the head. Remember that these masks must be kept clean, must be put on outside the sick room, must not be handled after they are tied on, and must be boiled 30 minutes and thoroughly dried each time they are taken off. And specifically, the next part of the column is directed towards workers. Walk to work if possible. Avoid the person who coughs or sneezes. Wash your hands before eating. Make full use of all available sunshine. Do not use a common towel, it spreads disease. Should you cough or sneeze, cover your nose and mouth with a handkerchief. October 11th, 1918. 45 more cases of influenza in the city. 33 houses are placarded for epidemic, no deaths reported. And throughout this story, what strikes me that I didn't appreciate to the same extent back 17 years ago when researching this at first is the extent to which the efforts of Dr. Rusted and public health made a difference in flattening the curve of the epidemic. In this clipping here also mentions the hospital now has a total of 54 patients. Its capacity is 60 beds with a chance for setting up others in case of necessity. October 12th, 1918. City bars closed by Board of Health. State board sanctions move to stay epidemic. 46 new cases, 3 deaths. Reading from the middle of the paragraph here, Dr. C.F. Dalton of Burlington, Secretary of the State Board of Health, advised more stringent operation of the general order, which has affected gatherings of all kinds in view of the rapid spread of the pandemic and the increasingly serious results in the state. He stated that Rutland and Fairhaven were the only places in the state which had not already closed bars. October 17th. Rutland physicians and health officials also believe that the worst is over in the city. 33 new cases were reported yesterday to Dr. Rustout, City Health Officer, as compared with 40 on Tuesday. The progress of the disease results in more cases of pneumonia than in the earlier days of the epidemic, however. And the increased number of sick people and those convalescing reduces the available household assistance to a point where the nursing and domestic health situation is acute. And it's important to note this. In many families, every member is sick, and many pitiful cases have been reported as having no assistance whatever, those ill attempting to do for others in the family at the risk of their own lives. By the end of October, in the city of Rutland, things leveled off. But what we all have to realize with pandemics like the influenza epidemic of 1918 is that there are second waves. One of the differences between presenting now and when I researched this 17 and 18 years ago, I could still have access to people that had stories of how this impacted their family. I remember interviewing Dominic Paul. Dominic Paul's father's first wife was a casualty of the epidemic in January of 1919. Mr. Paul noted that his father's household was already at a strain then because he had living with him his wife's brother and their children, and now his wife died with 2 children, and this created a real hardship of how a family could cope with the loss of the mother. One of the things that is very different about how deaths were reported, particularly those of women, is that when we look at the little headline here, the death of Mrs. D.C. Paul. There is nothing in this article that would tell you her name was Antonetta Franzoni Paul. In the social etiquette of the time, she is known by her husband's name. And in the other instance, virtually at the same time, we have the death of Mrs. Patrick Dunn, Abigail Dunn, whose daughter, Cassie Parsons, told me 18 years ago that she can remember as a child of 4 how violently ill her mother became. She remembers when the body was taken out of the house, transported to Rutland Hospital, where her mother died just 14 hours later. And with the story that Cassie told me, I have one small indication of how lives were so disrupted from this. Because although Cassie's father, Patrick Dunn, was not a casualty of the epidemic, he could not take care of his own children. So Cassie and her brother were parceled out to various relatives who raised them. And by an incredible irony, when Cassie married in 1940, she married a flu orphan epidemic, a man, Carl Parsons, originally from Woonsocket, Rhode Island, whose mother and father died 5 days apart. And Carl, like his bride, was raised in a foster home. And all these years later, unless some of these families have transmitted some of their stories through oral history, these are the things that we have lost. Because when the show aired originally 17 years ago, there were people in their 80s who had direct memories of the flu. In beginning to resolve our presentation today, I am struck by this image that was taken in Seattle, Washington in January of 1919 during the second wave of the pandemic. And here we have the law that went into effect that no one could enter a streetcar without wearing a mask. So this image from the National Archives shows the streetcar conductor halting the man who is carrying his package, and he is saying to this person, "You cannot enter the streetcar without wearing a mask." The person that emerges for me as the hero in this saga is Dr. Rusted. I didn't know a lot about him because the first time through I just noted, oh yes, he is the city health officer. But when I think of how those precautions, the only things that they had available in 1918 and 1919 to combat this. He knew what to do for basic safety and sanitary precautions. He was then a man in his 70s. He was an alumnus of the University of Vermont Medical School class of 1876. He lived until 1936, and here is an excerpt from his obituary. Dr. Rostedt served the people of the city as a health officer for many years and never swerved from his duty, distasteful as it was in the earlier days, to enforce quarantine and sanitary regulations. Interesting to speculate how many lives were saved because of those regulations and precautions. In 2003, historian John Barry wrote a book called The Great Influenza, very detailed account of the pandemic. In 2018, in a new edition of the book, he wrote an afterword. And again, this is 2 years before our present pandemic. And this is what he concluded some 15 years after writing his book. Quote, "There was terror afoot in 1918, real terror. The randomness of death brought that terror home. So did its speed. And so did the fact that the healthiest and strongest seemed the most vulnerable. But as horrific as the disease itself was, public officials and the media helped create that terror, not by exaggerating the disease, but by minimizing it, by trying to reassure. A specialty among public relation consultants has evolved in recent decades called risk communication. For if there is a single dominant lesson from 1918, it's that governments need to tell the truth in a crisis. Risk communication implies managing the truth. You don't manage the truth, you tell the truth." So there are many things that we can learn from history. We think sometimes that terrors of the past cannot happen to us now. And yet I think as we think of our present situation and what we are all experiencing, and I think by the time this is over, we will all know someone who has been directly impacted by all of this. And I know that on a very personal level, although I have stayed very safe and of course came to the studio wearing a mask today, for people who are in healthcare facilities, for example, my mother who is now residing in assisted living, it makes it very, very difficult for us to have contact with them, but these precautions must be enforced. It's been very illuminating for me to go back in time and to look at something that we once presented, but the work of a historian is never finished when we continue to look at ways we can evaluate the past through different prisms of the present.